Hey everybody, Organized Biology, and in this segment we're going to talk about how you actually diagnose congestive heart failure. There's three main methods to this and we're going to go through each one very quickly. So the first one we're going to talk about is BNP levels. Now BNP, this is a hormone, okay? So it's a chemical messenger in your bloodstream that we can measure the amount of. And BNP stands for B-type natriuretic peptide. So I'm going to get to what this means in a second, but first, why do we release this during heart failure? Well, BNP is released whenever the ventricles stretch too much and the heart begins getting stressed. So the heart itself actually releases this hormone. So think about it. So normally when your heart's functioning fine, your ventricles will basically expand whenever blood comes in, contract back, and all is well. But remember from the previous segment video, we talked about how it's a buildup of fluid with congestive heart failure because your heart's not efficient enough to get it out. So therefore the blood will pool and pool and pool, and thus it will push out on the ventricular walls a lot. That stresses the heart out, and that will cause the heart to, my marker's out, that will cause the heart to release that BNP. Now, as you can expect and suspect, the more the heart stretches, the more BNP will be released. So depending on the level of congestive heart failure, you're going to have different amounts in the bloodstream. So I want you to remember these values right here. So here I have a bunch of different values of BNP in your system, and it's measured in picograms per milliliter, so a very, very small amount. If you are below 100, you do not have heart failure. This is normal. However, once you get into the 1 to 300 range, this is when we suspect heart failure. And now once we get into 300 to 600, this is considered mild congestive heart failure. And you people are smart. What do you think I'm going to say next? Well, likely the 600 to 900 is obviously moderate CHF, and then above 900, that's when it's severe, okay? So obviously, depending on the patient, wherever the levels are, this is a very conclusive way to figure out if you have heart failure due to the ventricles stretching more and more and more, making more of this BNP. Now, I mentioned I'm going to talk about this a little bit, right? Keep in mind, this BNP molecule stands for natriuretic peptide, right? Whenever we're looking at natri, we know that that means sodium, which is Na+. That's why it's called sodium. And then uresis or uretic, this usually means urine. So is the heart peeing out sodium? Well, no, it's a hormone, remember, and hormones go everywhere and they talk to certain parts of the body. And in this case, we are going to be going and talking to the kidneys. And what BNP does is it goes and talks to the kidneys and tells it to excrete out sodium, because if we excrete out more sodium in our urine, we're also going to excrete out water in our urine. If we do that, it's going to decrease our blood volume. So therefore, we're going to have less blood in general. And why are we doing that? Why is the heart telling your kidneys to pee out more blood volume? Well, it makes sense because if we have less fluid, there's going to be less stretching of those ventricles. So it's its heart's way of basically protecting itself from stretching too much, okay? Great. Second way we can do it is through an echo or an echocardiogram. Now, in an echocardiogram, we're going to be measuring the efficiency of the heart muscle itself. And the way we do that is we are going to test the ejection fraction, or EF, you might see it. So what's an ejection fraction? Well, it makes sense. When your heart is filling, the blood is pooling in the ventricles and it's just about to contract. When those ventricles contract, there's going to be a certain percentage of that blood that's going to leave the heart. That's going to be considered your ejection fraction, and it's going to be in a percentage. So in this case, 70% of this 100% was ejected and 30% was remaining. This is actually called your end systolic volume. If you wanted to learn more about that, you can watch this cardiac output video that I have right here. But anyway, we're looking at that ejection fraction. Now, once again, I said this is measuring the efficiency of your heart, right? Why is that? Well, because the higher the number of blood ejected, your heart's doing a darn good job. It's being very efficient, right? So, if you think about heart failure, right? The blood is pooling in the ventricles, are getting weaker and weaker and weaker. What do you think will happen to this ejection fraction? Well, it'll likely decrease, right? And the value we're going to look at is if this ejection fraction goes to less than 50%, that's when you can begin to suspect heart failure. And obviously, as it gets lower and lower, so say 35%, this is when you know that you have heart failure. And at this point, you are basically confirmed that the heart is failing in some way, shape, or form, okay? So depending on the clinician, they're going to look at different numbers, but generally speaking, we're talking under 50%. Great. Now the last thing, a thoracic x-ray. We can also look at your x-rays to figure out if you have heart failure. Now I'm going to put a picture up on the screen right here, so I want you to look at this, and I'm going to point out two things that you're going to be looking for in an x-ray of the thoracic cavity. The first one is you're going to look for heart enlargement. Okay, so if you look at the normal and then the abnormal one, you can tell that you can see that outline of the heart much bigger in a person who has congestive heart failure, okay? And the second thing, you might actually already see it, is you will see what's called pulmonary infiltrate. I love the word infiltrate for two reasons. Number one, it is basically filtrate that shouldn't be there. It's a bunch of like fluid and proteins and buildup of stuff that shouldn't be in the lungs. And that's very common, remember, because congestive heart failure, congestive means a fluid buildup, right? We saw that in the previous segment of video. But also, if you think of infiltrating, right, you're going into some place that you probably shouldn't be. And if you think about pulmonary infiltrate, it's stuff that's in the lungs that really shouldn't be there, okay? So if we see any of these two things, we can suspect congestive heart failure. So now that you know what heart failure is and you know how to diagnose it, let's figure out how to treat it in this next segment of video. So I'll see you over there.